Well, you've probably seen them yourself practice in high gear for high school athletes and really thousands of student athletes of all ages. But unfortunately, some of those kids might be at risk. We're talking about undiagnosed heart conditions, among other issues. So this morning, pediatrician Marcus DeGraw and heart specialist Deepak Shah, both here from the Providence St. John Health System, and we're talking about all things kids. Good morning, gentlemen.
Good morning.
Let's first talk, Dr. Shaw, so we know that this is a tragedy when we hear about an athlete of any age suddenly collapsing because they seem so healthy. How does that happen where we're caught so off guard?
Well, again, there's just a lot of genetic conditions or things that we just can't screen. So, again, family history, if it's genetic, sometimes you can pick it up. Symptoms the kid has, is he passing out when he's exercising, is he feeling lightheaded, getting inappropriately short of breath. So those are the things you can look for, and again, EKG is helpful, but look at the case we had in Michigan. Again, just going back to it, they said he had a big dilated heart. You wouldn't have picked it up. It was probably a virus he contracted a couple weeks ago is the hypothesis, and then there's just no way. And again, so it's just very unfortunate most of the time.
It's unfortunate. The one thing, though, that we should take away from this is that it doesn't happen very often.
It's very rare.
Very rare. Dr. McGraw, let's talk about some of the screenings. We have to get our kids these sports physicals before they play. Are those adequate? What are they looking for?
Well, it depends on the exam that you're getting and where you're getting it done. We're trying to not only screen just for cardiac risk, but general health, concussion risks, joint injury risks. We're trying to screen your child for any kind of problem that they may have during athletics. So it depends on how good the exam that you're getting and the history that physician has taken is. If it's a good exam and a good history, then it's going to be helpful.
And a lot of it is done just with the conversation about family history and asking the child about any symptoms they may have, right?
Correct. As of now, the best screening that we have in place required for all athletes is to take a good solid family history and a personal history for that athlete. Do they have any risks in that history that put them in a higher category for being concerned for cardiac risk?
All right, when we talk about warning signs, we talk about shortness of breath, irregular heartbeat, passing out, seizure. These are sort of general warning signs that there could be various problems, right?
Correct.
Things that parents and coaches should be looking for.
Absolutely.
Let's talk about asthma, because this is a busy time for allergies. We know that. And how do allergies affect asthma risks, especially in student athletes?
Well, a lot of times allergies and asthma go hand in hand. Asthma essentially is an allergy manifesting in a patient's lungs. That's essentially what asthma is. So they go hand in hand. Not everybody who has allergies has both, but those are things that we're looking for that go together. So we're looking for patients who have unexplained coughing or shortness of breath during exercise or at risk, or unexplained coughing during highlight times like at night.
Okay, and when we talk about athletes specifically, if your student comes home from a practice and is coughing excessively, it could be undiagnosed asthma.
Certainly, unexplained exercise-induced coughing is one of the red flags for asthma, and one of the things that your doctor needs to discuss with you about possibly treating.
All right, Dr. Shaw, what about screenings, EKGs or those types of screenings? I mean, should all of our young athletes be getting those as a precaution?
Again, it's what we can afford as a society in terms of health care. Again, the cost to screen every just athlete would be $2 billion in this country every year, and that's not including our kids who play recreational sports. So again, is that cost benefit, or should we worry about childhood obesity? Should we worry about other things? And again, even an EKG doesn't always answer the picture. A lot of times you're going to miss some things, and a lot of things, again, you're going to catch thinking, oh, I've got something here, is going to be a false positive, meaning that we think we have something, but it's not true, and then we're going to do all this other testing, restrict students from sports and all of this. So again, it's a difficult situation, but I'm not sure there's a really good answer for that.
All right, so as of right now, it's just proper screening and paying attention, having good coaches who pay attention, and as a parent, of course, asking your kids how they feel.
Sure.
I think, and having defibrillators on the practice field, I think that's
right.
The key punchline.
That's a good final word. All right. Dr. Shaw, Dr. DeGraw, thank you both for being with us this morning.
Thanks for having us.
All right, and back to you guys in the studio.